So I'm very excited about this conference. I couldn't make it last year. I'm excited to be invited back this year. So it looks like a pretty comprehensive conference. They're covering all aspects of urology over several days, obviously in a beautiful place. And I'll be talking about some of these molecular imaging agents, when to use them in your toolbox. So again, we have the ability to use the gerentuximab-based imaging with CA9, but we also use quite a bit of a SPECT CT here with sestamibi. Occasionally, patients actually do have PSMA imaging as well when they have another diagnosis of prostate cancer. So sometimes we use these tools to help risk stratify patients to come up with a better informed treatment decision. So we'll be talking about that. We'll also have a tumor board where multiple experts in the field will be discussing some complex patients. I think they'll be presenting some cases, and we'll go about our thought process about when to do open, when to do robotic, when to do a partial, when to do a radical, how to approach things like an IVC tumor thrombus, and kind of giving our spiel in terms of also when to give adjuvant therapy. So I think it'll be a great conference and be good to chat and run through cases with some of my peers. Yeah, so there's a lot of obviously ways to skin a cat. Small renal masses, it's really hard to do a randomized trial where you kind of approach it partial nephrectomy versus ablation versus, radiation. There are a couple novel tools such as histotripsy kind of moving forward, which is in clinical development. But just hearing from my colleagues about how they go about managing the workup and how they go about deciding what to do surgically. We have a new fancy robot called the single port robot. Some of us are starting to use it as opposed to the multi port robot. There are some potential advantages, smaller incisions, maybe quicker operative time, but it is more expensive. It is a longer learning curve. So just hearing from my colleagues how they're integrating that into their clinical practice will be quite interesting. Yeah, so I think the audience will really kind of hear kind of where the fields are moving. There's great sessions on kidney, prostate, bladder, also benign urology. I think just bringing back for their, in their own practice, they might be able to get some kind of quick tools or tricks that might make them, more efficient in their practice and maybe help them help their patients. Again, doing, hundreds of these cases every year. I do about 150, kidney cases a year. We might have some, tricks and tools that they can bring back to their practice that we've learned to maybe make things more efficient, lower, the treatment burden on patients.